Hello, welcome to Adapt NCLEX. Today, I just want to give you a very brief overview about disaster and mass casualty and triage. This is a very straightforward, a very quick one. It's to simplify things in your head. So I'll give you the tips and tricks to do these questions easily. So let's get to it. So first of all, the trick is straightforward. You have to know the reason why you're doing disaster. Okay, what is mass casualty? The idea is different from regular trauma. Regular trauma is you taking care of one patient and you want to save that patient as much as possible. That's normal one. All resources for one person. That's all. But in triage scenario, that's different. We want to save a lot of people as much as possible. And so that's the difference. So whoever you think is sick, you take care of it. And then the one that you think you cannot save him, you're not going to waste time and waste resources on them. You're going to use that resources to save somebody else. And so we color code them to red, yellow, green, black. Basically, 4 people. I want you to narrow it down to 2 people. All you need to take care of is 2 people. So, but I will tell you what each of them means. For the person who is red, okay, the red person, I'll put them here. Red person means that what it means is emergent. You have to take care of them right away. And these are the group of people that you usually classify them. Somebody who is in shock. Of course, you cannot check their blood pressure at the scene. Usually, these patients are seen in the scene of the trauma. You can't check their blood pressure, but there's still certain things that should tell you that this patient may be in shock. So you will see like a wound that is bleeding, pulsatile bleeding, basically bleeding wound. Yes, that means you can see hemorrhage. Or if you see the patient lying in the pool of blood, that means that patient has bled. And sometimes the patient is completely cold, unconscious, but this is bleeding. They are in shock. They're sitting in the middle of the blood. There's another clue that tell you they are in shock. You see a traumatic amputation. So their leg is completely cut off or almost about to cut off, and you can see blood there. That patient is in shock. It's not going to do anything. You don't have, but because they may not give you their blood pressure, but they will give you signs that this patient is not normal patient. That's the first person. And the second one is airway. How would you know their airway? Well, you see, they will show you signs. They will have like stridor, okay? They will be wheezing, okay? But the wheezing is inspiratory wheezing. So these are the words you should be looking for in the sentence. They will be grunting. You have to be sharp about it. Look at my B sharp. Those are the words you see in the triage. This is the same thing, prioritization. So they will be grunting, or the patient will be drooling. That's what you're trying to look for in an airway patient. If they give you vitals, fine. Their heart rate, it is saturation is low, but you don't have those information unless they give it to you. But in a triage information, it's quickly you're looking at them. You're just doing assessment by just looking, and you're moving from one place to another. You don't have time to be checking blood pressure or respiratory rate. In your exams, I don't think they will give you. They will just basically give you the information, the signs and symptoms, and you have to make a decision that this is an airway sign and this is this thing, a breathing sign. Then the second one, that third one is chest trauma. Anybody who has chest trauma, remember, is going to affect the airway and breathing. Okay, so they will have a breathing issue, they will have airway issues. So if you have chest trauma, I will prioritize it with anybody. It may have a rib fracture, that may have punctured the lung, or they have like a pneumothorax. And so that's why I put chest trauma. I don't want to list them, but this is pneumothorax, basically, or hemothorax, or penetrating, something is penetrating to the chest. So to simplify it, you said chest trauma. Anybody that have chest trauma has an airway and breathing issue. Okay. And the third one is basically they have a wound that has not been taken care of. So wound that is like bleeding and is unstable wound. So example is like fracture with bleeding. Okay, it's the same thing as the shock. Fracture with bleeding or fracture without a pulse. Okay, that's that's not good. Okay, fracture without a pulse, that means they have bled to the point that they get to that place and then they just bleeding and then there's no more blood and they will go into shock. So that's a sign. So this is how you can break it down. Just that's the red for you. The then the yellow people, okay, yellow people are here. Okay, yellow. Where is the yellow? The yellow people are people that you have time to take care of it. I'm not going to tell you who they are because on your test, they will ask you, who do you see first? Don't worry about them. Okay. They won't ask you who will be yellow. It's a prioritization question. So they're going to ask you for red person. So the yellow people, what it means is you have time. You have about 30 minutes to 2 hours to take care of them. So you have to deal with them later. And the green is like somebody who is just walking, okay, walking wounded. That's what we call it. Green walking wounded. So he's wounded, he's talking to you, he has fracture, but he's still walking. Yeah, that's the green for you. The black, okay, the black is somebody who is dead. Okay, tell them dead. They are dead. Black people, they dead. That means they have severe head injury. Okay, severe head injury. That you can't do anything about it. Like somebody with a head injury and you see the brain matter. Okay, you can see the brain out. You can't waste resources on that patient. Patient is dead. So severe head injury. Somebody without a pulse. So no pulse. You check their pulse and they have no pulse completely. No pulse. That one is dead. And apnea. That means they can't take any breath. Even people with apnea, sometimes when you have to push, you have to do jaw thrust or and you have to protect their airway. And so you open their jaw and see if they're going to breathe. If they don't give you any breathing, that means they still apneic. That means they're not breathing. They're dead. You classify them as expected. They're going to die. Okay. And then sometimes they will give you a patient who has burn wounds. So total greater than like 70, okay, 70% total body surface area. If the whole body is burned about 70%, they're not going to survive. You don't have time to take care of that patient. It's unexpected to die. So those are the four groups that you have. Okay, dead person is severe head injury, no pulse, he has no pulse, it's no breathing, and he has large amounts of body surface area. Okay, the walking wounded are the green, the yellow, that means it's in between them. So my technique, okay, listen carefully. My technique is to just focus on these people, red and black. Leave the yellow and walking and the green alone. So this is the yellow and green. Don't even think about it. Don't figure out what kind of symptoms they're going to have. You simplify the four into two. It's either you're red or you're dead. Either I need to take care of you or dead. These people, somebody else will come and take. So take care of it. Remember, it's a trauma. So you want to find the one that you need to save his life right now. This guy is dying. You need to save his life. These people has time, so we can wait. This one, we don't want him to become black. So that's why you focused on the red and the black. Don't worry about who is yellow. Don't worry about who is green. It's not going to save you. Your test is a prioritization. So who do you see? If it's in nursing school, yes, they'll ask you yellow and green, who do you assign? But in the NCLEX exams, you are supposed to assign for red or unexpected. So they won't ask you who is dead. They'll ask you who is you going to save? Who are you going to see first? It's a priority question. Priority question is not going to ask you who are you going to see second, who are you going to see third, or who is dead. It's who are you going to see first. So we are going to focus on red. Worry about yellow and green, just worry about red and black. And since black is dead, you choose A. So that's what we're going to use and solve these questions. So we have 3 questions. We're going to use the idea. We're looking for red and black. And when we get them, we take the black off. And we use the same things we already talked about. So which client the nurse should see immediately? After a major car accident, a nurse arrived at the scene. Like I said, this is usually at the scene. You don't have any support, you alone, a bunch of people saving them of the trauma. Which one you see first? We're looking for red and black. I don't care about yellow and green. So a client with left leg fracture with decreased pulse. Well, this is not part of the one I told you about. I told you about shock, okay? Airway and a wound, okay, that has fracture and is bleeding, okay? And then, what is that? And the one who has fracture and bleeding. So having a decrease of pulse, you can put them in yellow. It's likely to be one of them that may go into yellow. You need to take care of them, but you don't have to worry about it. A client, there's nothing that tells me is in shock. A client with leg laceration and asking for pain medication, well, I eliminate it. I'm not even going to assign color to that. A client with lower leg amputation with a large pool of blood, okay, that's my clue there. Large pool of blood, this is shock. He has amputations too. It's one of the techniques that I put down. Therefore, I'm seeing that patient. So I assign this to be red. A client of 85% total body surface burn. I told you anything greater than 75 is black. So I have my red and my black. Therefore, I choose my red. So C is the right answer. Don't worry about yellow. Don't worry about green. Just care about red and black. The same thing. Which client should be seen first? After a multiple car accident and nurse arrive at the scene, which client should you see first? Okay, a client with the head injury, with the clear fluid leaking from the nose. So he has bad head injury and he has CSF leaking, clear liquid fluid leaking from the nose. That's CSF. This is bad. The brain is injured to the point he has so fracture, cerebrospinal fluid is leaking out of the nose. That patient is not going to survive. ICP is going to be high. You don't have time. The patient doesn't have time, so he's dead. So this become my black. A client with a sucking chest wound and a shortness of breath. I told you every chest wound is a priority. It has to be red. This guy has chest wound and he's sucking. So that's like sucking chest. You got to treat it, sucking chest pneumothorax. So then you have shortness of breath. This is our red. We're not going to even look at the rest, but you can see, read them. A client screaming for his mother. Good luck with that. A client with deformed leg and a palpable pulse. I'm not going to assign anything to them because I've got my red and that. And this is not one of the three, the stuff I give you earlier on for the signs of red. Signs of red is shock, they have airway issue, they have chest wound, and they have wound that is unstable, is not stable, like they're bleeding, they have traumatic amputation, yeah, they have fracture with bleeding. Those are the things you worry about. Or fracture without a pulse, but you got to make sure there's evidence of bleeding. So this one, we have black and red. So I would choose red. This guy sucking chest wound. The last question, the same thing. The same, I keep on changing the symptoms. A client, which client the nurse should see immediately? Priority patient. So first, so I'm looking for red. A major car accident, the nurse arrived at the scene of the trauma. Okay, I'm looking for red. I'm going to eliminate every other one. Looking for red and black. Don't do the four, red and black. If you get your red and black, look at the answer choices and see if you really selected the red and black, and then you focus on the red and black. A client with unresponsive, okay? It's not responsive, no bleeding, no respiratory effort after position of the head. So it's unresponsive. You move the head, see if you can open the airway and see if they're breathing. No, that means this patient is apneic. So, and that's one of the symptoms of black. Okay, he's not moving single air. So that's my black. I need my red. A client with multiple laceration to the leg. He's not in shock. He has no airway. He has no unstable wound, and he has no chest injury. 4 things I'm looking for. None of this. I'm not even assigning any color. A client with crushing chest injury and a chest rising with inspiration. He has chest injury, 1, and a chest rising with inspiration. Normally, when you're breathing, okay, when you take a deep breath, look at it, take a deep breath and see your chest is rise up, so out. It rises up. And then when you take and you breathe out, it goes in. So if your chest is rising when you're breathing out, we call it paradoxical breathing. This is the diagnosis of a flayed chest. We call it a flayed chest. And what happened? They have ribs here. So like ribs that multiple ribs has been fractured in succession. So rib number 1, 2, 3, 4, 5, like has been fractured. There's every rib is fractured on that side. So when they take a deep breath, that side cannot elevate. It just drop down. And then when they breathe out, it just elevates. So this is flayed chest. So this patient is my red. We'll read this, but we're not assigning color. A client with a leg fracture who is limping. Well, nothing. It's not one of my people. So I have a black here and I have a red here. So I choose this. So once again, the easy way to make triage is to look for red and black. The black patient is who has no pulse, pulseless, is apneic, is not breathing, even if you adjust his airway. Okay, he has more than 75% of his total body surface area is burned. Very severe neurological injury. That means his brain is like, he has massive brain injury. He can't even, he's unresponsive. Or there's injury to the brain that you can see the brain matter, or there's injury that there's a CSF leak. Those 4 things is black. Then you go for the red. Somebody is in shock, and shock can be like the fracture wound that is bleeding. Okay, patient is completely cold, and you have a pulsatile bleeding. Yeah, it will lead to shock. Then airway, you're looking for signs like wheezing, inspiratory wheezing, a stridor, drooling, and grunting, paradoxical chest. Yes. And then third, somebody with a chest wound, either sucking, penetrating chest wound, all of them, any, you just classify them. If you have chest wound, I'm picking you as, unless they tell you it's laceration to the chest without any sucking or anything like that. But any chest wound is your priority. And then lastly, you have a wound that is bleeding, okay? Not just, you can have a fracture, but there's no bleeding. Wound that is bleeding is red. And this will help you triage anybody. Of course, if you are in nursing school, you got to know the yellow and the green. The green is walking wounded. You wounded and you're walking. So somebody injured and is screaming, or is just fractured but still walking. The yellow is in between. Okay, he has wound that is serious, but he has time, about 2 hours, to take care of it. 30 minutes to 2 hours. So that doesn't become your priority. In this NCLEX exams, in order to answer this straightforward triage question, they want to ask you, who do you see first? So focus on, instead of 2 people, 4 people, just breaking down to 2 people and look at it red, red, red. Once again, thank you for listening. Take care of yourself. Keep charging and subscribe to my YouTube channel and the Facebook. Thank you very much. Bye-bye.